Thank you for your nice overview about the Indian situation. Since you are such a large group of people living on this continent, I assume you don't have enough vaccine available right now, and you're still looking for this vaccine. But are there groups which actually reject vaccination for religious reason or for others? And are people which have a hesitancy to be vaccinated like we will find in Europe?
Well, we do not have any active vaccine resistance, but we do have some degree of apathy and also a certain degree of assumption that the worst is over. Most of the urban areas have had high levels of vaccination. We have had so far about 78% of our population receiving at least a single dose of the adult population, and about 33% have received both the doses. Our problem is in getting the people who have had the first dose in rural areas and small towns to come back for the second dose. Part of it is access. Part of it, they think that now getting back to work is more important than get vaccinated. Now there's a drive to take the vaccines home rather than expecting people to come to their facilities. So different methods are being tried to overcome this vaccine hesitancy and apathy, but there is no active vaccine resistance as such.
Edward, a short question, please.
Yes. Ivermectin is being used in India and some states. What is your experience with ivermectin?
Well, it started in Bangladesh, and because Bangladesh doctors claimed a lot of success with it, many doctors in India, in Mumbai and Delhi and other places started using it. But later on, once steroids were proved in the recovery trial to be useful, that became less of a use. But it was being used in home care. But now the Indian Council of Medical Research, which initially included it as a possible use in home care, has now removed it. And therefore, right now, the consensus is that it should not be used, though some people may continue to use it because of their own conviction. But by and large, the use of ivermectin is being officially discouraged and is also not being pursued to the same extent as it was in early part of this year.
We ask Jose to ask the last question in short. Yes. Jose, please.
Yes, thank you very much for your presentation. My curiosity is your last comment about people believing that the worst is over. We are seeing this behavior in the entire world. In the US, in many places, people are really reducing the amount of protection. They are doing large gatherings. People are even removing requirements for masks and things going down. Are we doing that too early? Is that going to generate another spike? What do you think is the situation in India, in the world, about this sort of this perception the worst is over and this sort of levels of protections going down?
I entirely agree with you that it's premature to start celebrating and assuming that we are protected. Even assuming that many of the big cities are showing serosurveillance positivity of about 85 to 90%, it doesn't mean that everybody in India is protected. And unprotected populations could generate variants. And if variants are generated in other countries, they can still sneak in and enter your population. And particularly, we know that the immunity is not long-lasting, whether because of vaccine or because of natural infection. So at least for several months more, we need to be on guard. But unfortunately, the human tendency is to believe that everything is fine and we can get on with life. But we are repeatedly, from the public health community, sending out this cautionary note that do not turn your back on the virus, because it has not turned its back on you.